With the death toll mounting in Ontario's care homes, a key question is, were they prepared? Surprise and detailed inspections, like this one previously recorded by our hidden cameras, exist to ensure homes are running safely. But CBC News dug through government reports, finding those annual inspections have all but disappeared for more than a year. Pinecrest, where at least 29 had died by this morning, last faced a resident quality inspection in June of 2018. Eatonville, with at least 27 dead, last checked in September 2017. Seven Oaks, 22 dead, June 2018. Anson Place, 19 dead, June 2017. It's a long list and reveals the Ford government has quietly stopped these detailed checks.
It's incredibly frustrating to hear this. There ought to be inspections of long-term care homes, just as there are of schools and of daycares.
But that, she claims, is not what the largely for-profit companies running most Ontario homes want.
They have lobbied routinely for deregulation of long-term care homes, a reduction in the number of standards, a reduction in the unannounced inspections.
And they have political connections. The chair of Chartwell, one of the largest companies, is Mike Harris, former Ontario Premier, who also cut the inspections before they were later reinstated.
We will overturn every rock, every boulder, if that's what it takes to protect their most vulnerable.
The Ontario government says every home is inspected at least once a year, but after complaints, critical incidents, and reports of serious harm. Critics point out the home knows the inspectors are coming, and the inspection is less detailed.
That's very upsetting.
For those with parents in care, it's yet another concern.
I think that's something that everybody should be aware of, because it is very scary.
Her mother lives here after years of facing yearly quality inspections. The last was 18 months ago. David Common, CBC News, Toronto.
Now's a good time to bring in someone who understands the scope of this problem very well. Dr. Samir Sinha, the Director of Geriatrics at Sinai Health System in Toronto. And Dr. Sinha, there are a lot of Canadians out there who are just wondering, gosh, I mean, what do I do at this point? Is there some way that I can pitch in to help? What?
It's scary right now, and every family out there is quite anxious because they're worried about their loved ones. They wonder if their home might be next or if their loved one might catch COVID. And so really what I say is, know that the governments are actually following the latest evidence that's just come out federally. Governments are taking action and they're doing the best they can, and the care workers are doing the best they can. But reach out to the home, ask them how they're doing, ask them potentially what you might be able to do for the staff to support them and make them feel supported. But most importantly, if you have a loved one in care, reach out to them. If you're anxious, they're anxious too. Give them a call, a video chat, and see what you could do to maybe make them a little less anxious as well right now.
Okay, some good advice there. Dr. Sinha, thanks so much for your time.
Thanks, Andrew.